it's been a long time coming. We have dreamt about this. We have visioned about this. We have spoken about this. We've had several discussions about this with Dr. Honga and his team. And I've listened a lot to Dr. Frank Jenga and heard what his vision is. And it was so much aligned with what Jubilee Health has, which is basically that there's no health without mental health. And so for today, we want to say that as Jubilee Insurance, being the pioneers and being the number one in the country, and actually not in the country, but also in East Africa, Kenya, Uganda, Tanzania, Burundi, and Mauritius, we say that this is the time to put in and bring in the next frontier of health, which is mental wellness.
The mental wellness program will take a comprehensive, preventative, and curative approach to mental wellness. Mental health is an issue of growing concern in our nation and across the globe. However, most of us have been cultured to understand mental health to mean mental illness. Mental health is a state of well-being that enables people to cope with the stresses of life, realize their abilities, learn well and work well, and contribute to their community. It's an integral component of health and well-being that underpins our individual and collective abilities to make decisions. Our approach with this product is two-pronged. One, we will equip you with the tools to self-monitor through digital self-assessment tools. And two, we'll give you affordable, comprehensive care options that support you in remaining healthy.
We are very proud of the partnership with the Jubilee Health Insurance. There has been a very long-standing partnership with Jubilee Insurance, and this product is just deepening our existing partnership and relationship with Jubilee Insurance. Jubilee Insurance is a leading insurer not only in Kenya but in the region. Statistics are very clear on mental health. Mental illness is globally on the rise. When COVID-19 happened, the pre-existing high numbers of mental illnesses went up by 26%. Many people came to understand that mental illnesses are important. The stigma that is related with mental illness stops many from accessing dignified quality mental health care services. And Jubilee Insurance has come to understand that if you deter many from accessing dignified quality healthcare services, they suffer in silence, and with time the cost of healthcare goes up. So they have chosen to invest in promotive, preventive healthcare services.
The new thing that we're doing this morning by launching this product is to say we are no longer fools. We are no longer deluded. We want to put in a system that ensures, just like we diagnose hypertension in the community before it goes to intensive care, we will pick out mental health needs long before they have presented to the GP and we are confronted with diagnosis of mogongo or kichwa or at the very worst, a stroke.
The human brain has so much that it needs to absorb in a very fast-changing world. And so a lot of people can't cope with that pressure and they fall off the cliff. How do we respond to this challenge? And we respond with the law. The law has been changed, so we now have new law. So Parliament has done their bit. Then institutions must respond. Hospitals, I'm glad Chiromo has responded. Okay, it has grown to respond to this challenge. So even as today, as Jubilee Health, we are responding by introducing a product that then addresses this challenge. We need to do more research in mental health. How do we make sure that the engine of the human body actually healthy enough to drive that body for the longest possible?